Hello everyone, today we're talking about low back pain, and this video is for everyone. No matter what diagnosis you have, how you're experiencing your low back pain, this information will help you. Now let's talk about it. Some people will have a diagnosis of stenosis. Now what that means is there's a narrowing of the little holes in your spine. So when the nerves are coming out, they're getting compressed. So usually those people don't like to do this. Usually extension it doesn't make them feel good. It's flexion because it's creating more space for those nerves. People who experience in the past or present a disc issue generally are not happy in flexion, and they're much happier in extension because the disc is poking out that way. If I bend forward, it's going to poke more on my nerve. If I go like this, it's going to do it less. Degenerative disc disease, that's something lots of people have. They say over a lifetime, the research shows that 90% of us will experience back pain. Degenerative disc disease is just basically wear and tear on the discs. Now, arthritis, who doesn't I feel like arthritis is, diagnosed for many different reasons, just basically pain sometimes, but it's real. So again, it's more of a wear and tear. So if you can imagine, I've got this beautiful long spine. If I'm putting pressure where I shouldn't because of posture or surgeries or tension in the body, chronic tension, then if I even put the pressure on my spine just in a different way, I'm going to rub somewhere that isn't designed to be rubbed, and that's where the that little malalignment, I guess we'll call it, is part of the reason why we get things like arthritis, right? And then what you can imagine for another little reason for things like arthritis and not being totally aligned is there's tiny little muscles around every single one of our joints, including our spine. And there's little muscles in the spine that go from bone to bone all along the spine, and their job is to really help us with that alignment. And what happens is when we get pain, those little muscles don't do their job properly. They kind of get shut down. I call it snoozing. Again, I don't think people walk around that they're so weak. It's just their little stabilizing muscles around the joints are snoozing. Now, how do you wake them up? Let's talk about this. Whether you're someone who shouldn't be doing this motion a lot due to pain, or shouldn't be doing this motion a lot, or maybe both hurt. I mean, there's every scenario is possible. I'm just giving you guidelines. I'm going to give you some things to do throughout your day right now that can help that. Across the board, when you have that chronic low back pain, what happens is, I would say 90% of the time, you've got your glutes are like snoozing. Okay? So imagine you've got the little stabilizers along the spine snoozing due to the pain in your low back, and then the glutes, your buttocks, are snoozing as well. That's not good. That's not good. We need to wake up your glutes, whatever your diagnosis or your issue is. We need to wake up the glutes. How do you do that 30 times throughout your day? Just by bringing awareness to it, to not make it such a big deal, but to make it really impactful. You think about every time you stand up, you put both feet on the floor, you put your weight in your heels, and you get up however you're getting up. Maybe you need to hang on to something. Maybe you get up without hanging on to something. But what you'll want to get to is not doing the lean forward like that. So the more I have weight in my heels, the more I'm going to wake up my glutes when I stand up. The more I have weight in my heels, the more I will stay upright as I stand up instead of leaning forward. Those are good things to wake up the glutes, help your back over time. Another thing you can do throughout your day to really help yourself if you're experiencing any type of low back pain is every time you go up a step, you want to put your whole foot on the stair. Same thing again. You want to push into your heel. You want to not push. You want to make sure your weight, you're thinking about your heel. That's all you really want to do. And as you go up each step, if you're thinking about your heel, you'll notice, hopefully, that you're engaging more of your glute, your buttocks. You can even engage it. You can even contract it to say, hello glute, come on, this is your moment. I'm going up the stair, help me out here. Or, hey, I'm getting out of a chair, help me out here, glutes. Those are two really good things to do for sure. Now, the kicker is the better we breathe, the better we move. So why wouldn't we use breath, correct? It's a phenomenal tool to get those muscles that should be working, and waking up things that are snoozing. Now, again, with the problem with pain and why it can become so chronic is because the pain really gets us into a bad pattern. Like I said, those muscles tend to snooze. So we want to wake them up, whether we're in pain or not, so that we can start to shift our pain. If you just put your hands on your lower back now, so you've got your hip bones, put your hands right above it, what you can do is just now relax your shoulders and breathe into your hands. Have you ever thought of taking a breath and thinking about it going into your lower back? This can be so helpful, especially in the moment for the people I work with who are experiencing low back pain. And over time, it can be a game changer to really help manage it. Again, waking up those glutes, breathing into the low back to, again, really wake up those muscles that are supposed to be stabilizing your spine, that are snoozing. So incredibly powerful because it works. And again, the more you can bring awareness to this throughout your day, if you're just going to do an exercise routine in the morning and hope for the best, that's great. It may work for you. Fantastic. When you have chronic issues, the best way to start to shift them is bringing awareness throughout your day. Again, if I do that 30 times between the steps I take and every time I stand up, and then if I think about doing some breathing into my lower back, maybe that's 50 times a day now that I'm engaging consciously my buttocks, my glutes. I'm thinking about engaging those inner muscles in the lower back with my breath. That combination, whether, again, you've got spinal stenosis, arthritis, degenerative disc disease, a herniation, they will help you. My whole gig is to help you have tools that you can use at any moment that are going to shift your pain. Now, if you don't do any of this and then you get super acute and then you try it, is it going to work great? Maybe, probably not. This is the people who win are the ones who do this consistently over time. Those are the winners because they slowly shift and those muscles start to support them all the time. They stop snoozing. And those patterns of engaging your glutes and breathing into your low back become your new pattern. Hallelujah. Wouldn't that be great? And that is a huge, huge way to start really taking the power back, get your power back and start doing things in your daily routine. And I'm not saying you're not doing things in your daily routine to try and help yourself, but really that awareness throughout the day. When people do that, the patients I work with, bam, it's like a light bulb goes off for them. And the greatest thing about chronic issues is the second you guys start to feel better, you forget you ever had it. So I said to someone, I in my community live a pain-free life. I have a group coaching call every week, and I said to somebody, hey, are you able to breathe into your low back? And she goes, well, I guess I'm doing it right because my low back doesn't hurt. But of course, I had to ask her because once things start feeling better, we forget we even had them. Wouldn't you love to be doing that right now, forgetting you even had the pain? And you can wake up your glutes, breathe into your lower back. I have lots of other videos that are, I think I have a breathing video on this page, all sorts of things. So scroll down, check them out, and let me know how it's going to transform that pain. Have a great day. Bye-bye.